طيب, I'm going to mention something about competency-based practice. وحقيقة, if you look at this particular patient, as a matter of fact, what we have practiced actually here is actually all about the medical expert. الأشياء اللي احنا عملناها is all about the medical expert. ولكن الآن عالميا العالم كله moved, the whole world actually has moved. إنه we need other competencies other than the medical expert competency to help our patients properly. Yani we cannot just do it based on the medical expert role. Well, as a matter of fact, they discovered that what makes good doctors are not the medical expert role, but the other competencies, right? The communicator competency بذات. This is the one which really matters. This is the one which really matters. Right, I'll just try to explain what I mean by competencies. Now, a competency is defined as a standardized requirement. And what are the skills that you need to have to fully fulfill your job? If these are the skills, what are the skills you have that you need to successfully accomplish your duty? وقالوا السكيلز عموما او الكومبتنسز هذه مكونه من ثلاث اشياء. فيها النولج, so you have this is the cognitive domain, وفيها البروسيجرال سكيل, وفيها الاتيتيود. The attitude, the way you actually approach الاشياء اللي هي your mental model. Okay, but we need knowledge, skills and attitude الثلاثه عشان to accomplish a competency or ability. فالكومبتنسي معناها المهارة. Okay, ايش المهارة؟ المهارة دي we need knowledge and we need skills, procedural skills, and we need a right attitude to do it. Okay, this is what is the definition of a competency. Okay, now the Canadians هم طلعوا بحاجة اسمها الCanMEDS. Okay, والCanMEDS دي قالوا إنه to be a successful clinician, a clinician has to be an expert in 7 competencies. The one I talked to you about is called the medical expert. The one I just talked to you about, اللي هي 7 steps دي كلها تبع الميديكال expert. لكن there are another 6 dimensions. إنه we need to be good communicators, good collaborators, good leaders, good health advocates, good scholars, and good professionals. قالوا if a physician or a clinician does not possess all, or actually is empowered in all these competencies, they are unlikely to deliver high quality care. Okay, طيب الميديكال اكسبرت هو الخبير الطبي، الكوميونيكيتور هو المحاور، الكولابريتور هو المتعاون. اوكي، السكولر هو الرجل العلامة، الادفوكيت هو المناصر او المدافع، البروفيشنال هو المهني، كويس، والليدر هو القائد. These are the 7 domains. قالوا if a clinician does not possess all these 7 domains, they are unlikely to be competent in their practice. وأنا الحقيقة I was very pleased when Dr. Mohammed Al-Fatih actually shared that he actually trained his house officers to actually deliver the management of a patient using the competency headings. بمعنى إيش؟ He used the competency headings to build a management plan. As a leader, what will you do? As an advocate, what will you do? As a medical expert, what will you do? As a communicator, what will you do? And as a matter of fact, you will find that super clinicians use the competencies in their practice on a daily basis. Super clinicians use these competencies in a daily basis. They might actually do it. They might actually do it without knowing, but they are using it in a daily basis. They are actually good advocates. They are good communicators. They are good medical experts. Now, as a medical expert, the things I have actually shared with you, like the bedside, diagnostic, labeling, and 5S, but actually these are the medical expert skills. Okay, and you can tell, if you do this, you are a medical expert. Okay, if you use calculators when you see a patient, like scoring tools and calculators, we spoke about rheumatoid or SLE scoring tools, or NIHA or CARE, or BMI or creatinine clearance. If you use this, you are a medical expert. Now, when you see a patient, as a matter of fact, if you look at every patient you see, every patient should have a BMI done. Every patient should have their creatinine clearance done, right? Why? Because these are tell us whether things are proper or improper. If I see a patient with pneumonia, I should do a CanMEDS score, right? These are important elements, right? Now, communicator. Now, when examples of communicators, for example, doing the history and physical is part of communication. Doing the SOAP or SPAR for actually handing over, for consultation. These are all, you can use SPAR and SOAP for documentation, or you can use them for consultation as well. Counseling skills like dealing with angry patients or breaking bad news or disclosure of error. These are all part of the communicator role. Now, these are all part of the communicator role. Now, something called motivational or therapeutic communication. These are all part of the communication role. Now, there is no way that a clinician would be a good clinician if they do not know how to do proper documentation of the history and physical, how to document SOAP, how to consult using SPAR, or how to deal with breaking bad news, for example, or how to motivate their patients. Now, these are examples of communicator input. If you ask any clinician and tell them, how will you be able to work if you don't know how to do this? They tell you there's no way they can do their job properly. Now, this is the SOAP, the subjective, objective assessment and plan that people, should use when they are writing the follow-up notes, right? And I'm glad, Al-Ribat now is leading in this. Mustashfa Ribat is leading in this. Their doctors there are being trained to how to use the SOAP as part of their normal routine, right? Using the SOAP in actually documenting their follow-up, right? Or the SPAR in actually consultation, the situation, the background, assessment, and recommendation, right? And as a matter of fact, when I have my trainees, right, I tell them, can you please consult, for example, the hematologist? And before they consult, I tell them, how are you going to actually convey what we want to the hematologist? Most of the time, they do it wrong. Most of the time, they say, for example, we are having a patient. I'll just give an example. We are having a patient with pancytopenia, okay, and we want the hematologist, okay, and they start by saying, I have a patient. Hello, I have a patient with diabetes, hypertension, chronic kidney disease, but that's not the right way, right? You have to start by the right statement. I have a patient with pancytopenia or pancytopenia. And the background the background is a 70-year-old so-and-so with diabetes, hypertension. And my assessment is that pancytopenia is possibly related to aplastic anemia from drug-induced aplastic, bone marrow aplastic anemia, right? And then my recommendation, I think this patient needs a bone marrow trephine biopsy, for example. You see, now you have done it in a very professional way, right? But if you don't teach people how to do it, they will not do it properly. Then the collaborator. Now, there's no way that people can have this competency unless they are trained, how to be effective, work together in an effective team, how to do essential consultations and referrals, if there are interpersonal conflicts, how to resolve them. And some also community collaborations is also part of the collaborator role, right? Now, these are important elements or skills that a clinician should actually possess, right? Effective teamwork. What are the effective team building skills? They are committed to one goal: coherence, communication, democratic, and creative. Now, these are important skills of a collaborator. Now, if you go to the advocate, now advocacy, that many doctors in Sudan actually, practice advocacy. When they collect money for a needy patient, right? And the patient needs, for example, social and psychological, biological needs, educating patients, screening and preventative interventions. These are all patient needs, and they are considered advocacy or munasara or mu'adada. Okay, these are considered advocacy or mu'adada because the patient might not tell you about them, but you ask them. The biological needs. Are you sleeping properly? Are you eating well? Are you opening the bowels properly? Are you passing urine properly? These are biological needs, right? Or screening. for example, do you want us for an old lady, مثلا 50 or 60-year-old lady, do you want us to do a mammogram or bone mineral density, right? Or vaccination. These are all considered advocacy or مناصرة or معاضدة. وطبعا in Islam is a religion of المناصرة أو المعاضدة. يعني إماطة الأذى عن الطريق هي معاضدة or مناصرة. You are stopping people from being hurt. This is actually essence of الإسلام, المعاضدة أو المناصرة. Okay, معاضدة ومناصرة الناس الماشيين في الشارع عشان ما يتأذوا، إماطة الأذى عن الطريق. Okay, مثلا breastfeeding is actually a form of advocacy. For example, ربنا سبحانه وتعالى في القرآن يقول وحمله وفصاله 30 شهرا. Is God يعني سبحانه وتعالى, he's advocating for breastfeeding. This is all advocacy. Advocacy for the baby, the unborn baby, is advocating for them. Right. Referral to patients, friends, and societies. This is advocacy. Also having community health needs and determinants of health, working on improving them. This is advocacy. Education of patients, counseling, psychosocial support, referral to patient friends, societies, and support groups, or risk factor counseling, smoking, weight, soul food. This is all about education and advocacy, right? Screening is advocacy. Prevention, so many people put DVT prophylaxis, but they don't know what it is. You ask them, what is this action? They say it's therapy. It's not therapy. It's a preventative intervention, right? And it's considered a form of advocacy, right? The patient will not tell you, give me DVT prophylaxis, but you are doing to help him maintain his health. You don't want him to develop some a DVT and embolism as an inpatient. So this is a form of advocacy. مناصرة معاضدة المريض. Okay, the scholar input. EBM is a form of knowing about EBM and using the PICO, CARB scores, والأشياء دي, literature searching. This is a form of EBM practice. Teaching is a form of scholar activity. Doing research is a form of scholar activity, and attending like this session is a form of scholarly activity. And if you are doing any of these, you are a scholar, and بنسميه معلم, okay, because you are attending the important things for knowledge, okay. And for example, if you use the PubMed via PICO, not many people unfortunately use it at the bedside. It's accessible at the bedside. You Google it, and they use PubMed via PICO during their ward round. This is a form of scholarly EBM activity, right? And for example, you can put patient with heart failure, ACE inhibitor, beta blocker, and the outcome is prognosis. And you just in just a less than a minute, what is the better drug for prognosis, ACE or beta blocker. Now going to the professional role. Now the professional role is about ethical patient care. It's about dealing with ethical dilemmas like refusing medications or not for resuscitation, or people using unorthodox treatment despite being unethical unorthodox treatment or refusing steroids. Now, personal professional conduct, the way we dress, the way we behave, right? Upholding Islamic cultural values and upholding legislative regulations. Self-care, looking after one health. يعني الدكتور اهتمامه الدكتورة والفارماسيست اهتمامهم بصحتهم. These are all considered part of professional competencies. والآن هذه الأشياء, we actually as clinicians, we have to be aware of how to be ethical in our practice and how to look after our health, how to dress and behave at work. And these are important concepts. If there are ethical dilemmas, how to deal with them, right? And what to do about these unorthodox treatments and unethical treatment, right? Now, for example, this particular patient, somebody might come and say, this patient should not be in the ICU, لأنها she has end stage, maybe heart failure, and should not be intubated. So how do you deal with this ethical issue, right? Or if you see unethical practice from colleagues, how should we deal with it? Okay, these are important concepts. And the last one in the competencies is the leader. Now the leader would know how to have good time management. They need to know how to improve the service. Now, many people, you ask them, what is your job as a clinician, as a pharmacist, right? What is your job as a house officer, as a medical officer, as a registrar, right? And they tell you our job is to treat patients. As a matter of fact, the contract says your job is treatment, dealing with patients, looking after patients, but also one of your duties is improving the service, right? You cannot isolate this from this. You have two jobs. One is dealing with the patients, treating them, improving them, right? And the other thing, yes, is actually improving the service, right? And this is exactly what people are talking about, because they are doing it without knowing. They're working to improve the service without knowing that this is their second job. The first job is dealing with patients. Second job is actually improving the service. And this is actually, this duty is as important. And it's an important ethical commitment from doctors as leaders to improve the service. You have to know how to progress through your career, and as a consultant, you have to know what are your roles and what you call limits. As a registrar, your roles and limits. As a house officer, what are your roles and limits, right? So you have to know all these leadership skills, leadership qualities, quality management, career management, and clinical roles. In all of them, you have to know what your role implies and what are the limitations. So in summary, to be an all-round competent clinician, you have to have all these 7 domains, right? This is written here as manager, but now it is changed to leader, but it encompasses exactly the same elements, right? And so we have to be, able to realize and work on all these. And I'm glad to say that at Al-Tababa, we have a full competency-based training program ready for delivery. We just request to attend one full-day workshop on these competencies, and I'm sure Dr. Isam can certainly lead such courses, and people can actually get empowered and learn all about them, because these are important concepts, important competence that everybody should be aware of and know how to practice. So if I can stop here and we stop the recording, please, Ahmed.